We would never be able to make 250,000 calls and staff the costs that would do if we didn't have Phytel.
The product is easy to use for the staff, and therefore it's pretty seamless for the patient. For the physician on the back end, making sure that the patients are getting the studies that they need and making sure that they're getting the care that they need, it's really a win for all involved.
We've been using Phytel for over a year, started in December 2009, and have learned to enjoy it as each month goes by.
I think as we start moving towards population management, we look at the Phytel system as an extension of our practice in managing that overall population and trying to make sure that we're getting patients in a timely manner.
MGA and Phytel actually formed a partnership, and we're very pleased with that partnership because this partnership has been very beneficial to patients as well as to our own organizations. We've seen this grow from 2 organizations a couple of years ago to now more than 50 AMGA members are participating in the program. It works. It does exactly what we had hoped it would do in terms of bringing patients in who are at need and helping them to avoid adverse events.
Patients never want to think that they're sick or never want to think that they're not healthy. And so Phytel, by getting them in there, has helped really bring the reality to them that they have a disease state. They need to take initiative in it, and we care that they need to take an initiative, and we really want them to be a partner in this disease state, not a passive participant.
Phytel's been an excellent business partner for us, and as we've developed that relationship and gotten more comfortable, we've been able to even fine-tune some of our work together. So we've been able to take some of the clinical protocols that were in place and even modify them to better meet our physicians' needs and our practice needs.
One specific antidote that a physician shared with me was a patient that had difficulty managing many of his health issues. And he got the call from Phytel. He came in, his wife and daughter were in the lobby hooting and hollering and very excited that finally we got this fellow in and were able to put in place some care management for him to improve his health care.
You know, the thing is about identifying those patients who are at need, identifying those patients who really don't have the services they need in order to avoid adverse events and bring them into the practice. Right now, that's a win for everybody. You know, you generate revenue for the practice because you're billing for those services, but more importantly, you're bringing patients in, they get care, and they avoid a very serious adverse event. Nothing could be better.